Hi there, my name is Stefanie from Tree Integrative Health, and I'm doing a series of videos introducing Tree Integrative Health and functional medicine, what kind of things we do, and who benefits from this kind of healthcare, what kind of patients do we see. And today I want to focus a little bit on loose autoimmunity. So autoimmunity is one of those things that it doesn't just turn on one day. It's not like one day you're fine and the next day you have rheumatoid arthritis. So that process of developing an autoimmune condition can take 10 years, sometimes even longer, up to 20 years. And in that in-between time, we call that, in the functional medicine space, we call that loose autoimmunity. So those are folks that have fatigue, maybe they have some joint pain, maybe they have some muscle pain, but they don't quite meet the definition yet for things like rheumatoid arthritis or lupus or even Hashimoto's disease. They don't meet the definition yet to be requiring medication for that. So when you're in that in-between time, that's a really frustrating time for folks because they're going to their doctor and they're saying, I don't feel good. And they do this workup and they may say, okay, your rheumatoid factor is positive, but not quite enough for you to meet the definition of rheumatoid arthritis. Come back in 6 months, come back in a year. Your ANA is elevated, but it doesn't really meet the need for following up with rheumatology, or you follow up with rheumatology and they say, well, there's nothing we can do yet. Come back in 6 months or a year. It's really a waiting game. That's what's happening, is that the providers are waiting to get to the point where you actually need immunosuppressant drugs or things like that to really help with the disease process. So what can you do in that in-between time? A ton. There's a lot of stuff that you can do in that in-between time. You can identify your food triggers, because sometimes food sensitivities and food allergies that have gone unrecognized can cause and contribute to some of that immune system activation that leads to inflammation in the body. You can do some dietary changes. You can figure out why you're not sleeping as well and sleep better so that your systems work better. All of these lifestyle changes can happen that can really make a big difference in terms of how long it takes you to get to that autoimmune status, or whether you get there at all. So that loose autoimmune time, as frustrating as it is for patients, it's one of my favorite times to get new folks, because that's before the joint damage. That's before the tissue destruction. It's a great time to get started in functional medicine when we can actually really make a difference for folks. So if you find yourself in that situation where you have some labs that are abnormal, you have some joint pain, some discomfort, you know that there's something going on, but you're not really getting the kind of answers that you need, give us a call and we'll see if maybe you might be a good fit for the practice. Have a great day.